Good afternoon, everyone. Welcome back. Thank you for joining us. We're glad that you're here. I'm Steve.
And I'm Scott.
And together we're Backyard Musings, the Science and Technology channel.
Yes, sir. And we are talking this afternoon about a blood test that could help you out if you have any kind of cardiovascular issues. So this is a cool story.
A new AI blood test may forecast major cardiovascular disease risks years before clinical onset by reading real-time molecular signals in the body. A research team from the Department of Pharmacology and Pharmacy at the LKS Faculty of Medicine of the University of Hong Kong has created a new AI-powered tool for predicting cardiovascular risk named CardiOmicScore. Would you like to know more?
Okay, using a single blood test, the system can estimate a person's future risk of 6 major cardiovascular diseases: coronary artery disease, stroke, heart failure, arterial fibrillation, peripheral artery disease, I'm not familiar with that one, and venous thromboembolism. Okay, don't know what that one is either, but it doesn't sound good. It can also detect warning signs as early as 15 years before the diseases become clinically apparent. That's pretty good. And the findings were published in Nature Communications on February 2nd of this year.
So if AI has not been around for 15 years, how do they know it can predict it as much as early as 15 years?
Probably AI. It's probably telling them.
Their model says it. They input the parameters and it says it.
Yeah. Well,
Cardiovascular.
Doesn't 15 years sound better than 5?
Yeah, it does sound better. I'll buy that for $1.
Yeah.
Cardiovascular diseases remain the world's leading cause of death, causing approximately 19.8 million fatalities in 2022 alone. In standard health checks, doctors usually estimate cardiovascular risk by looking at factors such as age, blood pressure, smoking, and other conventional clinical indicators.
These measures, however, may miss early and subtle biological shifts that appear before disease can be diagnosed, which means many patients lose the best chance for preventative action. Polygenic risk scores have gained attention in recent years, but genetic risk is mostly fixed from birth and does not change over time. Well, I wonder if they could test you at birth.
Probably could, but I know like Shersty, she didn't want any kind of testing done because it's invasive. A needle goes into, the amniotic sac. She didn't want that.
Well,
Some people do.
That's before birth, right?
Right. Some people do want that. She didn't. Okay, as a result, these scores cannot show the immediate effects that lifestyle or environmental changes may have on health. This creates a strong need for tools that can reflect a person's current biological condition and offer accurate early warnings for CVDs.
To meet that need, the HKUMed or MED team used deep learning to combine multi-omics data, including genomics, metabolomics, and proteomics.
Found it out.
Okay, thank you. In the development of CardiOmicScore, the work used large-scale population data from the UK Biobank. Had no idea there was even one of those. Analyzing 2,920 circulating proteins and 168 metabolites measured from blood samples. We got to talk to the producers about these some of these words. These molecular signals function as real-time recorders of the body, capturing subtle changes in the immune system, metabolism, and vascular health.
Professor Zhang Qingpeng, associate professor in the Department of Pharmacology and Pharmacy at HKUMed, explained, quote, genes determine where we start. They define our baseline health risk. However, proteins and metabolites reflect our current physical health. Our AI tool is designed to decode these complex molecular signals enabling doctors and patients to identify risks much earlier, which can potentially change the trajectory of disease through timely lifestyle modifications and early prevention.
The results show that CardiOmicScore converts complex multi-omics measurements into personalized risk scores and performs substantially better than conventional polygenic risk scores. It might really help if I knew what half the stuff was that we're talking about here, but that's okay. When paired with clinical details such as age and gender, the model significantly improved prediction accuracy for 6 common CDVs and could identify elevated risk up to 15 years before symptoms develop. Okay.
This work signals a move in precision medicine away from a fixed gene-centered model and toward a more dynamic approach based on multi-omics. In the future, I never knew about multi-omics. This is something new. In the future, a small blood sample may be enough to produce a broad cardiovascular risk profile for multiple diseases.
Professor Zhang added, quote, "We aim to leverage technology to identify and prevent diseases before they develop. By shifting health management from reactive treatment to proactive prediction and intervention, we aim to create a lasting impact for both public health and individual patient care." Quote. I think that's great. The earlier the better, right?
Yeah.
At least that way, you've got the longer you have to be able to.
You can change the trajectory of your health,
Right.
Yeah. You can switch it up. You can start eating leafy greens.
I was going to say change your diet.
Start walking.
Yeah. Well, you should be doing those things anyway, but if you knew that you had a particular issue that you could hit it head on. So that's good.
Use both hands for the 12-ounce curl.
Yeah. And one more positive for the AI.
Yeah. AI.
We like it.
We did a segment on how AI can help you. Check that segment out. I think it was a week ago.
Yeah.
It's pretty cool.
AI is definitely got its good positive points. So, okay.
Thanks, folks. We'll see you tomorrow morning.
Take care, everyone. Have a great rest of your day, and we'll see you in the morning. Thanks.